everyone, this is 𝗥cie 𝗥𝗲𝘀𝗂𝘀 along with Tina from IILT. So today we are back with another role play where we are going to see a patient who is a cancer patient, right?
Patient, yes.
And that is Mr. Markings. So he is denying the treatment and the nurse has to try to persuade him to take the treatment, and that's what we are going to see today. So I'll play the part of the nurse and Tina will be doing the role of the cancer patient, okay?
Okay, so let's get started. You ready?
Yes, I'm ready.
Okay, and you can start now.
Good morning, Mr. Markings.
Good morning, nurse.
How are you feeling today?
Oh, what to talk about my feeling, nurse? See, I'm been diagnosed with blood cancer. Maybe I'm going to die today or maybe tomorrow because my days are getting numbered. I just want everything to be normal. I want just to see my children all settled. So this is what my mind is now.
Mr. Markings, I understand you're going through a rough time right now, but don't worry, everything will be all right. The reason why I'm here is because I was informed that you're denying the treatment advised by the doctor, right? I can see from your reports that the doctor asked you to commence with chemotherapy and you denied it. So
Yes.
may I know the reason why?
Actually, nurse, what is the necessary for me to do, like you guys to do chemotherapy for me? I know I'm going to die very soon. Then why do we need to do a chemotherapy?
Mr. Markings, I understand that you're emotionally really upset and you're overwhelmed, okay? But chemotherapy is the best treatment for you right now because it will kill the fastest growing cancer cells in your body, and that is really effective for you at the right moment right now. So that's the reason why the doctor also advised you to do that. And I was informed that you denied it. So is there anything else stopping you from continuing with the treatment?
Yeah, that is one major thing. Second thing, I've read from the newspapers and I've seen people now, okay, there's a lot of side effects that comes along with chemotherapy. You see, if I'm going to die, let me die with dignity. Let me not have any, my hair not falling off and having baldness or something like that. I don't want anything to happen to my skin or stuff. So I don't want any chemotherapy.
See, regrettably, as you mentioned, there would be some side effects for this chemotherapy, but if you look on the other side, if it is a very effective treatment for you and you can actually recover from it as well, and you are responding really well to the medications too. Okay, so the side effects, you do not have to worry about it. The common side effects can be controlled by the medication treatments that we provide from our end, and it can subside the intensity of the side effects as well, okay? So you do not have to worry too much about it. And also, Mr. Markings, from your reports, I can see that almost 40% of your cancer has been recovered, which is showing actually a hope there, okay? So if you continue with the treatment and if you follow all the instructions by the doctor and if you have a willpower and determination, you can definitely come back to your normal lifestyle. So what do you think about that?
I really like the way how you're trying to help me out and how you're trying to motivate me and making me understand about it. But still, nurse, let me be very frank with you. I do not want any treatment because it takes a lot of money. I know one chemotherapy, how much it is. I don't need to be a burden to my children. See, when I was at a young age, I used to help my children, but now as they have standing in their own legs, I don't want them to, shed all their money on me of all their investments. I don't want that to happen. I don't want to be a burden for them. And let me go on like this, nurse. I don't think I need a chemotherapy right away.
Mr. Markings, I understand you're having a very difficult time right now, but your family is very cooperative. They always come and ask me how you're feeling right now, and they're very supportive and they're really wishing that you'll come back to the normal lifestyle. So do not feel like that you are a burden for them, okay? And we are doing everything from our end because this is a well specialized hospital and we have seen many cases like yours, and you definitely have a hope. As I mentioned earlier, almost 40% has been recovered right now, so we only need to worry about the 60%. So with the right amount of treatment and the medication at the right time, you can definitely come back to the normal lifestyle. So could you please reconsider it?
The thing is, nurse, it's just not a small cancer. It's a blood cancer that's running all over my body. If it was any one part, yeah, we could say, yeah, you will recover from it. But being a blood cancer, I have read, I googled. You see, I'm a learned man. I know what it is and how it is. And in almost everything it says that, life expectancy is very less. Then why do I need to spend so much of money? I don't want to, nurse. Please, don't give me any active management. Let me die with dignity. Whatever was your procedure, please do discuss with my family members. I don't want anything to be done on my body.
Mr. Markings, I understand you're going through really a rough time, and that's why you are making such decisions. But if at all you could reconsider it, it will be really good, you know, because if you voluntarily suggest your name for this, we won't be able to support you or give you a further treatment from our end. So are you sure about what you're decided?
I'm 100% sure, nurse. Please go on with it and tell me what we need to do on those. Explain to me. I'll see what we can do about it.
Okay, so you have an option about meeting a counselor. Would you like to meet the counselor and discuss further about it?
Yes. Yeah.
Okay.
I wouldn't mind.
So I can arrange an appointment with the counselor to talk about it, okay? And since if you're going further with it and voluntarily nominating your name, we'll have we'll need your concern as well as we'll need your written consent from your side as well, okay? So I'll need to inform the chief doctor and talk to your family members regarding the same too. So is there anything else you would like to ask me?
Oh no, nothing else, nurse. Please get all the formalities done. I can sign wherever it is, and let's get started.
All right, okay. So I hope I have clarified everything for you, Mr. Markings. If at all there is anything else, please do let me know.
Okay, thank you so much, nurse. Yeah. Well, actually, most of the times, Richa, I have seen children asking me, students asking me, ma'am, can you do something, a role play related to grief?
Okay.
I think most of the settings we do not have a grief scenario, right? Maybe 1 or 2 role plays as such. So this is also a grief scenario, and to be frank, like Richard did very well. See, the patient is reluctant in the manner that he doesn't want chemotherapy, he doesn't want any sort of active management because it's a blood cancer.
Yeah.
He knows what are the pros and cons behind it and what comes after chemotherapy, the side effects.
That's right.
So the nurse has tried her level best to convince the patient.
But
too
he's
good.
not ready.
But he's still not ready because he has his own ways,
Yeah.
he has his own thoughts and stuff.
And we
right?
have to respect that
Respect
too.
the
We should
patient's right.
not force them too much. You can try to convince them once or twice, but not the third time. Third time will
Yes.
be a little more of forcing.
Because even in medical background, patient's right is very, very important.
Yes, exactly.
And we have to respect their right too, right?
They
Their
have
decision.
all the rights to decide for themselves. Yeah.
So I think in the feedback session, Richa will tell us how to handle a grief situation and in what ways we can talk in simple sentences, right?
Absolutely.
OET is all about simple sentences. So she'll tell us all about it, and we will see you in the next role play with another setting, with a new scenario. Till then, bye-bye, take care.
Bye-bye. Hello everyone, this is Richa from IILT. So I'm here with another feedback session for the role play which we witnessed just now. So in this particular role play, we saw a patient, that is Mr. Markins, who is really emotionally upset, okay, because he's a cancer patient. The doctor advised him to start with chemotherapy, but he denied it. So we are there to persuade him to start the treatment, but at the end, till the end, he's not being ready to do it. Rather, he asks for NFR. So let's see how we can do it, okay? So task number 1, begin with warm greetings and try to build a rapport with the patient. So we have seen many cases like this, so we know how to do this too, right? So we have 2 segments here, the greetings, that is the first segment. The second segment is building a rapport. So the keywords are yes, obviously, the greetings and rapport building, okay? So how can we do that? Good afternoon, Mr. Markings. How are you feeling today? So this is an oncology ward, and you know the patient is there in the ward and you have the details. So you can start the conversation by saying, good morning, Mr. Markins, how are you feeling today? So obviously we can expect a big I'm feeling bad from Mr. Markings there, because this is an oncology ward and we know the condition of the patients there, right? So he's definitely going to say a bad news. So as an answer to that, you can say, I understand that you're having a rough time, but don't worry, Mr. Markings, everything will be all right. See, you developed a rapport there. Okay, so that is how you do the second part. Let's see the second task. Ask why he's denying the treatment. So what is the keyword here? Denying the treatment. So denial of the treatment is the keyword here. So as a beginning to this particular task, you know, without just directly jumping into the task explanation, you can actually have an intro part. So you can say that I was informed that you were denying the chemotherapy advised by the doctor. So may I know the reason why? So that is how we can do this particular task. Okay, it is just another way of doing it. You know, just by simply asking why you're denying the treatment, that is not a very right way of approaching this particular patient. So as an introductory part, you can say that I was informed that you were denying the treatment. Is any problem there? You know, do you have any problem there? So you can actually start like that. Okay, so that is task number 2. Task number 3. Explain the importance of chemotherapy at this stage for survival. kills fast growing cancer cells. So when he's saying, when we ask him about why he's denying the treatment, he would definitely say some reasons about his idea about chemotherapy and why he doesn't want to do chemotherapy. So as an answer to that, we're going to do task number 3. Okay. So here the keyword is importance of chemotherapy and all the information which is given in the bracket. It kills the fastest growing cancer cells. Okay. So let's see how to put this into a sentence. You can say that, I understand you are having a rough time, Mr. Markings, but right now it is very important that you start with your chemotherapy because it is the effective treatment we can provide you to kill the fastest growing cancer cells in your body. This is how you can create a sentence there. So what I did was I just picked the keywords here and I just changed some words using the synonyms and I connected these keywords to create a simple sentence. Okay, so keep practicing like that. The next task, when asked, explain the possible side effects and measures to subside those. Okay, so this is a pretty tricky one because you're going to give a lot of negative information, right? Because for a cancer patient to know that he or she is going to have a lot of side effects which are very painful and long lasting, it's not a very easy way to present. So you have to make sure that you tactfully approach this. So here the keyword would be possible side effects and how to control it. Okay, so you can give a general explanation. You do not have to give separate explanation to each and every side effects. You can give a general explanation. Okay, so you can start the conversation by saying, Mr. Markings, as you know, there would be some side effects, but don't worry, we can definitely control the intensity of the side effects by some medications and comfort positions. Okay, and you might experience some side effects like some pain, difficulty in eating food, or you might feel tired, you might lose your hair, but don't worry, it is temporary and it will not be permanent. So you can just give some explanation like that. Okay, so that is how you can do task number 4. Now let's see task number 5. When the patient is reluctant, emphasize the importance by stressing on a bright future. Results show 40% of remission of cancer. A hopeful statement, right? So let's see what are the keywords here. So the keywords would be importance of doing this particular treatment by stressing on the bright future. Okay, so the keyword is importance of this treatment and bright future, and also we have to stress on the factor about the 40% of remission of cancer as well. So let's see how we are going to create a sentence here. Mr. Markings, I understand your reluctance to start the chemotherapy for you. However, as I mentioned earlier, it is a very effective treatment for you right now because you have a bright future ahead and also your body is responding well to the medications. So already the results show that 40% of your cancer has been recovered. So we only have to worry about the rest. So please be optimistic. You definitely have a future ahead of you. Okay, this is how you can do this particular task. Okay, so let's look into the 6th one. When asked, tell him he can definitely come back to the normal lifestyle, proper treatment and medications and willpower. So this is kind of like an encouragement and a reassurance format. Okay, so here we are going to stress on the keywords which is definitely come back to the normal lifestyle, and we have to also mention about the proper treatment and medications, willpower, which is mentioned in the cue card. So let's see how we can club these information to form a sentence. So we can say, Mr. Markings, I assure you that you can definitely lead a normal lifestyle with proper treatment and medications, most importantly a determination and willpower. Okay, so we will do our best from our end. So you need to make sure that you're optimistic and hopeful about your future. This is how you can do this particular task. So I actually used the same information which is mentioned in this cue card with a little bit of additions as well as eliminations. I actually rejected some words as well as I added some words here. Okay, so that is how you can create a sentence for task number 6. Now let's look into the last task. When the patient asks for NFR, explain the procedures, written consent, inform the authority. So here we have to stress on the keywords, procedures, and what are the procedures, okay? But an emotional factor here is that once or when a patient is telling you that they want to nominate themselves for NFR or DNR, do not just directly say, okay, then fine, we have some procedures, and leave the case there. You have to try to convince them at least once by trying to bring up some hope for them, okay? So here you can say that, Mr. Markings, I understand you made this decision because you're going through a rough patch of time. But let me just remind you that you're already showing 40% of improvement. So if you have a determination with the right amount of treatment, you can definitely come back to the normal lifestyle. So by any chance, do you have a reconsideration, okay? So he's again telling you no. So if he tells a no again, do not try to force him there, okay? Because he's not going to say yes there. He will keep on saying no, okay? So do not try to force him there. Rather than that, you can say, well, if that's what you want, I will inform the authority regarding your decision, and we will require your written consent that you are voluntarily nominating yourself for this procedure, okay? So is there anything else you would like to ask me, or is there anything else you want me to do for you? And you can finish the entire conversation. So let me just tell you a few things before we wind this session, because this is a case note where you're talking to a patient who is really hopeless. So rather than being too task oriented, what you need to be doing here is providing an emotional support for people like this, because that is what the interlocutor will be also looking forward, you know, whether you are being human there and you're trying to understand the emotional the context of the patient and trying to help the patient in that particular way. So you need a lot of good reassurance statements, and make sure that your explanations are not just the explanation of the task rather than a hope generation one. You need to, you know, generate hope or make the patient feel like there is still hope, okay? But in this particular case, towards the end also, the patient is not being convinced. We know that, so it's not your mistake. The patient is not being convinced there. That is how the cue card has been designed. So here I actually finished the entire conversation by actually giving a little bit of hope. I still gave a hope for him by saying that if you have any second thoughts, please let me know. Okay, so still when you're winding up the entire conversation by saying, okay, fine, you can nominate yourself for this particular procedure, but you're giving a hope there, okay? So this is how you have to deal cases like this. I hope this was helpful for you guys. If yes, let us know, and I will come back with another video. Stay tuned.
IILT, it's my cup of tea.